How did fundoplication become a modern GERD treatment? Imagine a tiny surgery that changed how doctors fight acid reflux forever. That's what fundoplication did. It all started back in the 1950s with a doctor named Rudolf Nissen. He wanted to fix a problem that made many people suffer from heartburn and damage their esophagus. Nissen's idea was simple but clever. He wrapped the top part of the stomach, called the gastric fundus, around the lower end of the esophagus. This created a stronger barrier, helping the valve between the stomach and esophagus work better. The first version, called the Nissen fundoplication, was a full 360-degree wrap. It was done through an open surgery, which meant a large cut in the belly. This surgery proved to be very effective at stopping acid from refluxing. Patients saw relief from their symptoms and their damaged esophagus healed. Over time, surgeons looked for ways to make the procedure safer and easier. They developed a minimally invasive method called laparoscopic surgery. Instead of a large cut, they used small incisions and special tools. This meant less pain, faster recovery, and fewer risks. As doctors learned more about GERD, they saw that it was not just about a weak valve. Sometimes the esophagus does not move food properly, or there is a hernia. So, surgeons started to change the original Nissen procedure. They created partial wraps, like the 270-degree toupee fundoplication, which still controls reflux but reduces side effects like difficulty swallowing or excess gas. Today, fundoplication is customized for each patient. Doctors consider how well the esophagus moves and whether there is a hernia. The surgery is often recommended when medicines like proton pump inhibitors do not work well. It restores the valve's function, preventing acid and other stomach contents from leaking into the esophagus. In recent years, more patients are choosing surgery earlier to prevent the worsening of their condition. When done by experienced surgeons, fundoplication offers long-lasting relief with low risks. It also helps with non-acid reflux and anatomical problems that medicines cannot fix. This evolution made fundoplication a trusted, modern treatment for GERD. It is a physical solution that restores the natural barrier between the stomach and the esophagus. The development of less invasive techniques and careful adjustments to the procedure have made it safer and more effective. Now, many people find relief from their symptoms and avoid ongoing medication use thanks to this surgical option.